With that, I'm going to invite Mrs. Dorica Dan, partly because where Mr. De Lorenzo ended was talking about the difference between pathologies where you have a very wide body of patients and that are intrinsically powerful because of the big numbers behind. In the case of the specific organization you represent, you're talking about rare disease, about people that ultimately, either for cost reasons, because the research in those fields is relatively high threshold, or because regulatory procedures usually refer to those elements that represent the bulk of the effort, are off the map sometimes. So how do you, as an organization, interact at national, at European level to address that?
In fact, I'm involved in Romanian Prader Willi Association as a mother of a child with Prader Willi syndrome. And then we created a National Alliance for Rare Disease, and we have over 40 national organizations as members of the National Alliance. And since 2007, I became member of the board of EURORDIS, European Organization for Rare Disease, which has almost 700 national organizations, and I'm also a member of the International Prader Willi Organization. And since the first European Committee of Experts for Rare Disease, I'm also a member of the European Committee of Experts for Rare Disease as a patient representative. So the difference in the work is huge. From national, local, because I'm based in Zalau, which is far from the capital, so it was one of our challenges in Romania, because we are almost near the border for those who are not from Romania, and it's difficult even to get to Bucharest from our town. So all the big things are happening in Bucharest, so in order to do our work of advocacy at national level, we have to travel a lot. In country and abroad. And I think the way that I kept my faith and hope in my work was that I'm involved at European level, and seeing the development from the last years at European level and in research, in advocacy, and in drug development, in capacity building of our members, seeing all this happening at European level, I could do my work in the country, because otherwise you have to wait a lot of things. But I will take the opportunity to thank you, Mr. Savu, for his personal involvement in orphan drugs regulation in Romania and supporting patients to get their treatment. Thank you very much. And I can say that in the last year we have some progresses at national level, and it happened mainly because there are a lot of deadlines also at European level, because the cross-border healthcare directive came into force, and we have to organize our care in Romania, and in order to be part of European network of references for rare diseases, and we have to accredit the centers of expertise and to organize the care, because most of the rare disease has no cure, in fact. Just a small part of the rare disease has treatment, and for those who has no treatment, it is very important to think about the care, about the fact that patients need more than the treatment. They need also social care, education, and other things. So we hope that we will use the European and international model, and we will have an integrated care also. And we, of course, we will do all our efforts to improve the access to treatment for those who have treatment, and hopefully we will be helped by the national authorities. And yes, so we will support all the research projects. We are also, as organization, we are accredited for research capacity, and we have changed our paradigm also in Romania from receiving support to delivering services. So we have a Center for Rare Disease where we have a large team of professionals involved, and as a patient organization we are service delivers too. So this is how things are working.
Thank you so much.